Feeling tired is common, but common isn't the same as normal for you. The key question is simple. Has your energy changed in a way that doesn't match your life? If your fatigue is new, heavier, or harder to shake, it can be a signal worth taking seriously. Not because something is definitely wrong, but because your body uses energy as a dashboard light. When the system is strained, energy is often the first thing to drop. And many people miss early clues because they keep pushing, adding more caffeine, and calling it stress. In this guide, you'll learn the most practical warning signs that fatigue may need a closer look. You'll also learn what patterns tend to point towards sleep issues, nutrient gaps, hormone shifts, mood overload, or medical conditions that deserve a check-in. The goal is not fear, it's clarity, because when you can name the pattern, you can choose the next step with confidence. Moving to slide 2. First warning sign. Fatigue that lasts longer than it should. Everyone has a rough week. The red flag is when rest stops working. If you take a weekend off and still feel drained on Monday, that's a different category. Same if you sleep in and wake up exhausted, or if your recovery time keeps getting longer after normal days. Persistent fatigue can show up with subtle patterns. You might notice you need more naps, more caffeine, or more time alone just to function. Or you feel like your body is moving through thick mud, even when your schedule is reasonable. This doesn't automatically mean a serious problem, but it does mean your body may be dealing with something ongoing, like poor sleep quality, chronic stress load, inflammation, low iron, thyroid issues, or an untreated sleep disorder. The practical takeaway is to track duration. If it's been weeks, not days, it's worth a closer look. Moving to slide 3. Second warning sign, you're getting enough hours of sleep, but you still wake up unrefreshed. This points to sleep quality, not just sleep quantity. A person can spend 8 hours in bed and still get fragmented sleep from stress, noise, pain, reflux, or breathing issues. One common pattern is snoring, gasping, or waking with a dry mouth, which can hint at sleep-disordered breathing. Another is waking up multiple times and not remembering why. Or you wake too early with a racing mind and can't fall back asleep. If you rely on an alarm and feel worse after hitting snooze, that's also a clue. Unrefreshing sleep often shows up as brain fog, irritability, and afternoon crashes. The takeaway is to stop judging sleep by hours alone. Notice the signals: morning headache, sore jaw, frequent nighttime bathroom trips, or a partner noticing loud snoring. Those details help a clinician decide what to check next. Moving to slide 4. Third warning sign. Fatigue plus brain fog that changes how you think. This is more than "I'm a little distracted." Brain fog can feel like slow processing, word-finding trouble, or forgetting why you walked into a room. You might reread the same paragraph 3 times, or you can't hold multiple steps in your head like you used to. This matters because mental energy and physical energy often drop together when something systemic is going on. Poor sleep is a big driver, but so are low iron, B12 deficiency, low calorie intake, blood sugar swings, dehydration, and some viral illnesses. Mood factors can also play a role, especially anxiety that keeps your mind constantly scanning for problems. The practical move is to notice timing. Is the fog worst in the morning, after meals, or in the late afternoon? Patterns like that can guide what to discuss with a professional and what lifestyle factors to review first, like sleep consistency and balanced meals. Moving to slide 5. Fourth warning sign. Your fatigue comes with shortness of breath, dizziness, or a pounding heart during normal effort. If climbing a few stairs suddenly feels like a workout, pay attention. This can happen for many reasons, including deconditioning, but it can also show up with anemia, thyroid changes, dehydration, low blood pressure, or heart and lung conditions. The important detail is new or worsening. You might notice you get lightheaded when standing up, or your heart feels like it's racing at rest. Some people describe it as being unable to catch a full breath, even though they're not sick. Don't try to self-diagnose from symptoms alone. Instead, treat this as a prompt to get checked, especially if it's paired with chest pressure, fainting, or swelling in the legs. Even without those, a clear change in exercise tolerance is a strong signal that fatigue may not be just lifestyle. Moving to slide 6. Fifth warning sign, you're sleeping more, but your motivation is flat and nothing feels rewarding. This can look like fatigue, but it may be more about mood and stress biology. Depression doesn't always feel like sadness. Sometimes it's numbness, low drive, and the sense that everything takes too much effort. Chronic anxiety can also drain energy by keeping your nervous system on high alert. If your fatigue is paired with loss of interest, social withdrawal, changes in appetite, or feeling hopeless, that's not something to power through. It's a sign to talk to someone qualified. There's also a middle zone, burnout, where you're not clinically depressed, but you're emotionally depleted and your recovery systems are tapped out. The practical distinction is this: if rest doesn't restore you because your mind never feels safe to relax, your fatigue is real and it deserves support. Naming it can be the first step toward useful help. Moving to slide 7. Sixth warning sign, fatigue plus unexplained weight change, temperature sensitivity, or hair and skin shifts. These clusters can point toward hormone and metabolic factors. For example, thyroid issues can show up as low energy, feeling unusually cold, constipation, dry skin, or changes in hair texture. On the other side, feeling overheated, shaky, or having a racing heart can also be part of a thyroid pattern. Blood sugar regulation can also affect energy. Some people crash hard after high-sugar meals, then feel better after eating again. That roller coaster can look like random fatigue, but it often follows predictable timing. None of this is a diagnosis, but it's a reason to notice clusters instead of single symptoms. If your body feels like it's operating in a different climate than everyone else, or your weight is shifting without a clear cause, write it down. Specific examples help your clinician choose the right labs and questions. Moving to slide 8. Seventh warning sign, fatigue with frequent infections, slow healing, or swollen glands. If you're constantly catching colds, or a small cut takes unusually long to settle down, your immune system may be under strain. That strain can come from many places: poor sleep, high stress, undereating, nutrient deficiencies, or chronic inflammation. Swollen lymph nodes can happen with ordinary infections, but if they persist or keep returning, it's worth discussing. Another clue is persistent low-grade sick feeling without a clear cause. Some people describe it as feeling run down, achy, and sensitive, like they're always about to get ill. This is where context matters. If you have young kids, a high-exposure job, or travel often, frequent infections may be expected. But if your exposure hasn't changed and your immune resilience has, that's a signal. Keep a simple log of infections, fevers, and recovery time. Trends are more useful than memory. Moving to slide 9. Eighth warning sign, fatigue with digestive issues that don't settle, like ongoing bloating, diarrhea, constipation, or reflux. Digestion is energy intensive, and gut problems can disrupt sleep, appetite, and nutrient absorption. If you're low in iron, B12, or vitamin D, fatigue can be one of the first symptoms people notice. And chronic gut irritation can make it harder to maintain those levels. Another clue is fatigue that worsens after eating, especially heavy meals. That can be normal sometimes, but if it's consistent, it's worth noting. Food intolerances, celiac disease, inflammatory bowel conditions, and chronic reflux are examples of issues that can overlap with fatigue. The point isn't to jump to the worst-case scenario. It's to respect the pattern. Energy and digestion are linked. If your fatigue improves when your gut is calm and worsens when symptoms flare, that connection is valuable information to bring to a clinician. Moving to slide 10. Ninth warning sign, fatigue that gets worse after activity in a way that feels disproportionate. This is not the normal tiredness after a workout. It's the kind where a busy day, a long meeting, or a light exercise session wipes you out for the next day or two. People often describe it as a payback effect. This pattern can show up in several conditions, including post-viral syndromes, autoimmune conditions, and chronic sleep deprivation. It can also happen when stress has been high for a long time and your recovery capacity is low. The key detail is the delay. You might feel okay during the activity, then crash later. If you notice this, pacing becomes important. Spacing tasks, building in recovery, and avoiding the boom and bust cycle. And it's a strong reason to talk to a clinician, especially if it's new after an illness. Bring examples, what you did, how long it took to recover, and whether symptoms like aches or brain fog followed. Moving to slide 11. 10th warning sign. Fatigue with pain that's widespread or keeps moving around. When your body hurts, sleep quality drops, and energy follows. But the reverse is also true. Low energy can make pain feel louder. If you wake up stiff, sore, or with headaches most days, that's worth noting. Some people have muscle aches, joint pain, or a heavy, flu-like body feeling without a clear injury. This can overlap with inflammatory conditions, autoimmune issues, chronic infections, or pain processing disorders. It can also be driven by simple factors like poor mattress support, low activity, or high tension from stress. The warning sign is persistence and spread. A single sore knee is different from whole body soreness that lasts for months. If pain is paired with swelling, redness, fever, or sudden severe symptoms, that's more urgent. For most people, the practical step is to document where the pain is, when it appears, and what makes it better or worse. Moving to slide 12. 11th warning sign, fatigue with changes in urination, thirst, or swelling. These symptoms can be easy to dismiss, but they're important because they can relate to hydration balance, kidney function, blood sugar, and heart strain. If you're unusually thirsty all the time, waking up often to urinate, or noticing blurry energy dips after meals, it's worth mentioning to a clinician. Swelling in the ankles or around the eyes can also be a clue, especially if it's new. Another pattern is dark urine despite drinking, or feeling lightheaded and dry, even when you think you're hydrating. Again, none of this is a diagnosis. It's about noticing when fatigue is paired with body fluid signals. The practical step is simple. Observe for a week. Note how often you urinate, whether you wake at night, and whether swelling changes across the day. Those specifics can speed up a useful medical conversation. Moving to slide 13, 12th warning sign, fatigue with hard stop symptoms like chest pain, fainting, confusion, severe shortness of breath, or sudden weakness. These are not wait-and-see situations. Even if they turn out to be benign, they deserve urgent medical attention. Now, for the more common situation, fatigue that's concerning but not an emergency. Here's a practical way to prepare for a checkup. Bring a timeline. When it started, what changed, and whether it's steady or fluctuating. Bring a symptom cluster list. Sleep quality, mood, digestion, periods if relevant, infections, and exercise tolerance. And bring your baseline, what you used to handle versus what you can handle now. If you want one simple self-check, rate your energy each day from 1 to 10 for 2 weeks and add one sentence about sleep and stress. That turns a vague complaint into useful data. If this helped, consider subscribing for more clear, calm health explanations. And comment with a forced choice. Is your fatigue more like A, sleepy and heavy, or B, wired and exhausted? This information is not a substitute for medical advice. Resilience is the foundation of longevity.